Hey, John. Well, both of those headlines, of course, more to do with Delta than to do with Omicron, the concerning new variant. Ireland looking at a real dramatic spike in cases, which are very most likely driven by Delta, as are so many of the spikes we are seeing across Europe. Here in the United States, perhaps the fears of Omicron driving people to get vaccinated and boosted in larger numbers. We're also seeing a lot more kids getting their first shots in the 5 to 11 age group. Today, we've had 6 additional cases of Omicron confirmed in Nebraska. There was one traveler who returned from Nigeria, and then it seems may have spread the variant to 5 household members, and only one of those 6 people was vaccinated. None of them are in the hospital. But the cases across the country accumulating now, multiple states reporting them, including 5 in New York last night. Governor Kathy Hochul, though, saying they do not plan any kind of lockdowns as a result. Here's what she said.
We're not having shutdowns. We're not changing our protocols. We are continuing where we are, but making sure that we work in concert together and encourage people to get tested often, get the vaccination.
And that's the message from federal health officials as well. John, also want to just point out some data that came out today in The Lancet in a commentary piece from some epidemiologists in South Africa showing how quickly Omicron cases are accumulating. You can see that white line there is this new 4th wave, and you can just see how much more quickly it's going vertical. The case doubling time is 1.2 days for Omicron. That compares with 1.5 days for Delta and 1.7 days for Beta, the previous variant. So there's just concern about how quickly this is spreading there, even as we still have so many more questions about the characteristics of this variant, John.